Good afternoon and good morning, good evening, everybody, depending on when you're joining us. Today we have the last session of our online course workshop, and we are joined by one of my all-time favorite speakers. And as always, if you have any questions or if you have anything to our speaker, feel free to type in the chat or raise your hand. And there will be a time in the end as well for discussions. And we will wait 1 to 2 minutes until everybody joins us. And in the meantime, I will be giving the floor to Ritu.
Hello, everybody. Welcome back to the third session. We're really excited to have you here. All of you that have stayed with us for the last two and the final one today. We really appreciate you spending your weekends with us. And for everyone that's joined Anga this last week, I hope that it was successful for you and you really enjoyed your time. We're going to start off with a short poll. If you remember from last week, we ran out of time and we were unable to ask the last poll. So I'll be doing 2 short polls and then we'll hand it over to Alona and she can go ahead and get started. This is the first one. Hopefully you'll be able to see the QR code. If not, you can follow this. I think I'm also able to put the link in the chat if needed. So the first Slido poll is which health priorities could be better addressed through digital tools or services? And also where are non-digital approaches better? So since it's a 2-part question, short answer, maybe you could put like a period followed by the second response. For all of you that have just joined, welcome. We're doing a quick Slido poll. You can see the QR code on the screen or also the link is in the chat. And so far, we've had 2 conversations, right? The first one around global health governance, where we welcome Katri and Rohinton, and they gave us a really great introduction about the intersection of global health governance with the digital transformation. Then on Sunday, we had a presentation around leadership, health professionals and policymakers, where Dr. Anurag, Dr. Emanuele, and a short video clip from Ran Balasar kind of gave a great introduction to all of the different ways as practicing physicians you can be involved with global health governance or other international means. And I really liked that conversation because it gave a personal dynamic and touch, which I'm sure today, if you've ever been in a conversation with Alona Kickbush, you also realize that she is a very humble and passionate person. So I hope she brings some of her personal touch to it as well. And today we'll be talking about the effects of the digital transformations of health and well-being, the case for the digital determinants of health. So I think I'll move on now to the second poll, and I think it will be a new link. Give me 1 second and I'll go ahead and share that link as well. We've got some responses. Sorry, I thought we just had the one, but now we've got a few more. So educational and community-based programs, NCD consultations, general management and patients' data recording, examining and diagnosing better physically in person. Wonderful. I'll leave that open and we'll go to the next one quickly. Here's the next poll. If you could improve your current health system, what would be your priority focus area? I'll paste it in the chat quickly. And these polls really help us not only visually afterwards when we create reports and blogs and things. But they also are really trying to help inform our current My Health Futures campaign, where we're looking at different responses from young people around digital first health systems. So some of this data will also be used for that. Okay. So far we have a landslide winner of easier access to services. I only see 4 people so far, so I'll leave both of these polls open and hopefully you guys can send in your responses. If you're having any problems with the technical aspect or getting onto Slido, just send us a chat message and we can support that. So without further ado, though, I'm going to pass it over to Alona. I've got to stop to share because I'm going to start to show the presentation. I know several of you have probably heard Alona speak. I know Adam was just letting us know that he's heard her before. She is hands down one of my favorite people to listen to and learn from. So of course, being the co-chair and having her leadership skills and also just expertise in this area, she had to join us. So I'm very happy she's with us. And yeah, I'll hand it over to you, Alona, and I'll start to show the PowerPoint.
Well, thank you very much, Whitney. Thank you, Adam. It's, of course, difficult then to live up to expectations like that, but I'll just share with you some of the priorities of the work of our commission and a little bit of an outlook what we would like to do as a follow-up, because from the very start, we were always critical. You know, you have a Lancet commission, then it's published, and then it disappears into the depths of time. And from the very start, we've been thinking about how to take the recommendations and the thinking forward and how we can continue work, also work with new partners. You've already met my co-chair, Anurag Agarwal from India. It was an enormous pleasure to work with him, and we had a fantastic group of commissioners. And you've already met some of the people that we hope to continue this work with, which includes Rohinton that you met and Anurag himself, as well as some others. So if we look at the Lancet report, I hope you've had time to read it. It was incredibly difficult to summarize our thinking. You know, 2 years work into a very constricted number of words and pages. But we were also lucky because we, of course, had the accompanying report, the report of the young people who had been working with us throughout this period as well. And this is absolutely unique for any Lancet report. Initially, there was discussion, you know, shall we add a youth commissioner, or you know, shall we just put a few paragraphs into our report? But there was consensus among the commissioners that the youth voice must be much more present, much more visible. And we were able to convince the Lancet that there actually be an accompanying report and that it also be published. One of the main things, and that relates back also to my previous professional life in whatever I do, I look very closely at what is the present narrative and does it need to be changed. And this was true also for this report, that in the end, we did change the narrative. It started out thinking about digital health, but it became very clear to us that the way digital health was being used was much too narrow. It was basically an addition to how we were doing health or healthcare at this point in time, just using digital means. It didn't really talk about changing the way we actually deliver health and healthcare, or the way we're organizing the power relationships within the health system. And actually, in the course of our work, it became very clear to us that to some extent, the way digital is being used is actually to cement certain approaches in the healthcare system to cement power relationships and also to increase the digital divide. So those were very big concerns for us, and they are reflected in our recommendations. But also in terms of changing the narrative, we said what we actually have to look at is what the digital transformation is, not only in a sense how it is impacting on the healthcare system, but how the digital transformation changes our lives as a whole, and therefore also finds itself reflected in our health and in the societal systems that we build. So we said we need a radical rethink on harnessing the power of digital technologies for future health based on a new paradigm. We had a whole number of recommendations. If you try to sort of group them into 3 big recommendations, we said we therefore need to address the digital determinants of health. We'll get to that in a minute. We need to start out from a value-based framework for governing health futures, not a, what can technology do? Let's do it type of framework. And as I already indicated, this is about the future, and therefore young people need to be very much at the center. We try to develop a conceptual approach to digital transformations of health. It's very much at the beginning still, and this is something we hope to take further to the work that we continue. But you see, what we tried to speak about was a larger ecosystem of digital transformations that then impact on health, and that they do so both directly and indirectly. And of course, in terms of doing it directly, it can be a direct impact on health outcomes, but doing it indirectly is the link of the digital transformation to the other determinants of health. And some of you will know that I've played quite a role over the last decade or two in working on determinants of health. The first very strong direction was to look at the social determinants of health. We then moved on to say, what are the commercial determinants of health? And there's a very, very rich literature and research right now on the commercial determinants that I recommend to you. And of course, as we have seen recently in the COVID-19 pandemic, the political determinants of health. And it says here the environmental determinants, but that probably isn't expressing it strongly enough. You all know about the discussions around planetary health, etc. So one of the key things also when we look at the digital determinants of health is the interface with the commercial determinants, because as we all know, in terms of the different systems and platforms that actually make digital health possible and that drive the digital transformation, much of that is linked to the power of the tech industry, to the commercial determinants of health, through very strong interfaces. I've already mentioned the inequalities. So the social determinants play a really big role also around well-being. And here, social determinants also relate to age. If you think of the COVID-19 pandemic, and people had to register for vaccinations, and in many countries suddenly you could only do that online. So that was an incredible issue for older people, and your digital competency actually decided over life and death. And so these are really important issues that we need to take on board. One thing that perhaps at this stage, this graph is also about a year old now. We introduced it through the report, is that we also need to get a much better understanding of the interface between the digital transformation and the new concept of planetary health. And we're starting to do some think work about that. Of course, as I already said, we really need to ask young people. And we were able to do the U report that, as you know, or some of you at least know, was able to question 23,000 young people from all around the world. And we asked them, you know, how do you use digital technologies right now? And what are your views on the benefits and the risks? If we just look at this very quickly, you can see that most children and young people use digital technologies to support their health and well-being. Improving fitness is the most popular of them all. But we also found that young people are uncertain how the future of digital health is actually unfolding. Is it something that will empower them? It's probably something you want to discuss in your groups. Will it empower or enfranchise, as our young people said? Or will it actually increase control and will it actually restrict the movement and the lives of young people? And you can see that here also reflected that the biggest concern are the privacy risks for young people. And again, you see this very strong message: access to health information is the biggest, the best, the strongest way that digital technologies can help manage health and well-being. And here, of course, being able to trust that information is an absolutely critical component. So as you probably discussed during your governance session, the trust architecture that allows you to gain access to health information, again, we saw it during COVID, is absolutely critical. Can you trust the source? Can you even find out who the source is? So you can see here 6 main issues: increase access, increase quality, build stronger regulation to protect from harms, involve young people in design. Co-design is absolutely central in all of these issues. Building trust, I've already indirectly alluded to. And of course, the whole issue of digital health literacy and digital health skills. And this, of course, is very different in different countries. And that has also led us to suggest a multi-country longitudinal study to say, you know, how do countries actually compare along those 6 main issues? One of the young people, I want to quote this here, said, "I wish someone would do a mapping of my home country to show the impact of connectivity on education, on our health, and on our well-being." So we need to be able to compare countries and then to hold policymakers accountable. So if we look ahead, the Commission is now transitioning. We've developed a proposal to work as a digital transformations of health lab. And the next slide shows you some of the issues that have emerged from the work that the Commission has done and from the young people's input. You can see there are, in the center, of course, is young people's digital health and well-being. And the more we have worked, the more we have become attracted to a concept that we call digital health citizenship. That underlines the democratic component, the co-designing and enfranchisement component, the access component, the equity component. So digital health citizenship is something that we will be taking forward to have a better understanding of that. And that, of course, relates very much to advancing value-driven approaches to digital transformations of health. And you discussed some of those issues, I'm sure. under the governance. The way we've approached some of the health systems and health information issues that you raised, we have in that other part where we say putting young people at the center of a digital first health system. And here we particularly want to work with young people from countries also where young people are the majority of the population, and say, you know, how do you want to transform your health system, and how can young people be in the center of that, and how can you enter that health system wherever you are, and also without having to perhaps not be sure about how private your information is in relation to the issues that you want to share. And the final thing then is we really, and the subject of this discussion, and that's where I'll be so excited to hear from you what you will discuss in the groups, is how to address the digital determinants of health and well-being. How should we take this forward? What do you think are the key digital determinants of health and well-being? And how would this influence the study that we want to do, comparing a group of countries with high youth populations around the digital determinants? And as I said, we see this package. You can see some of the other issues around it, like digital health literacy and skills, health leadership, and others. Our vision is a totally different type of health system. And we feel as important as the universal health coverage discussion is in the context of the Sustainable Development Goals. And next year, there will be at the UN General Assembly a discussion on universal health coverage. We want to influence that discussion with your thinking and say, you know, your discussion on UHC has been critical, but it is not transformative enough for young people. And this is what we want. So thanks for listening to me. And I hope you have a really great discussion in your groups, and we want to learn from that.
Okay, wonderful. Thank you. I know that we always take a bit of time to get warming up to each other, but if anybody has any questions before we go ahead and get into breakout groups, now is your chance. Since there's only one speaker today, Alona will do her best to kind of pop into the groups and drop little questions or comments, but do be patient if you don't see her straight away. We'll have about 12 minutes or so, 13 minutes for breakout rooms. Go ahead, Fatima, please.
Okay, thank you so much, Elena, for the great speech, and Whitney for giving me the opportunity to ask my question. So I noticed that during the presentation, Elena touched on the point that we really need to conduct national studies and researches to understand exactly the challenges of digital health within our own countries. So I want to make sure, or to understand more, how are you planning to do this in global health features? And if you are having any future plans to engage students in conducting similar activities.
Thank you, Fatima. I'll start with the last question, which is yes, yes, yes. We will continue to involve young people. We will particularly continue to involve this group, which is one of my favorite groups I've worked with over the last decade. And so that's a given. And also in our follow-up proposal, we have made that very clear. And we'll also be looking at additional funding for that. In terms of the countries, the way we have been thinking first, but we'll see how that develops, we identified those countries with very high youth populations. And you can do that in two ways. You can do that by saying, you know, just the percentage number of young people in a population, and you will know that for a whole range of African countries, for example, the majority of their people are young people, but if you look at their leaders, there is, a really big age gap. And so one thing was, let's talk also about health services with and in countries where actually then also the majority of the users are young people already at this point in time, and where often they have neither access to health services because they're very poor, or because there is no access to digital. Or as one person in one of our discussions said, in the morning I have to decide whether I eat or I go in the internet. So I think, there's really critical issues there. The other approach is to actually take actual numbers and say, which are countries that have enormous numbers of young people without them necessarily being the majority of the population yet. And, you can think of countries like Indonesia, like the United States, like India, of course. And so it's particularly countries where we feel strongly that as they shape health systems, and they are in the process of changing health systems, that we want to make sure their voice is heard, and that hopefully we can take that voice to the UN Assembly next year.
Wonderful, thank you. I think that we'll go ahead and go into breakout rooms so that we have enough time.
Okay, I sent you by mistake Whitney and Ilona. So I brought you here back so you can choose your own place. I'm sorry for that.
Looks like Muaz is trying to join a room.
Something. Okay, Ilona's in room 3. Should I leave her there or bring her?
Yeah, I think it's okay. I don't think I see everyone. I'm just going to pop throughout the rooms and I'll text you on WhatsApp when I need to come back. Some reason it doesn't give me the option for the plenary once I'm in a room. So.
Excuse me, can you repeat?
I'm going to pop in through each of the rooms just to make sure everyone has the mural board link, because not everyone's here.
Mm-hmm.
And then I'll text you to bring me back because I don't have that option.
Okay, good.
Adam, can you put me in another group?
Hello, Professor. Do you have trouble circulating?
Yeah. Can you just send me somewhere else?
Okay, I am very sorry. I was just getting water.
Yeah, no problem.
You were in room 3, right? Okay, so I'll send you 01. Where do you go? Okay, the 10 minutes are up, but I saw you send them 3 more minutes. I swear I didn't close it.
Can you stop the closure or no?
I can reopen it with the same people. That's the best I can do.
Uh,
Reopen it with same people.
I don't know if it will do the same automatic
It will. It will.
It will?
Yeah.
So, but I can't even do a broadcast message.
It's okay. When they come back, I'll just send them again.
Well, let's just see if they need more time.
Okay.
I saw Muaz has a comment. She got moved. People are coming back, I think. Hello, everyone. We had a bit of a technical breakdown with those breakout rooms. Does anybody need more time in the breakout rooms? Because we can go back. Okay, we'll do 2 or 3 more minutes then. Adam, go ahead and ship us all back. I know Dominique was in group 1. Oh, there he goes. Adam, I think if you could ask Alona to come to this group. If you want to move her back to plenary.
I'm trying, but she's not coming back. I don't understand why.
Okay. that's okay.
Today Zoom is acting really weird.
Maybe it's overloaded.
The last 2 sessions it went very smooth. Okay, yeah, Ilona's coming back.
Okay.
Possibly. No, she went to room 2. Okay, so she's doing her thing.
I wonder what's happened with group 3. They don't have anything on Miro. I'm gonna join them, okay?
I assume I should close it.
Sorry, I think I started the closing.
You started, I didn't close it.
I think it's okay.
Okay, you closed it now. It's fine.
Is everyone back in plenary then, Adam?
Yeah.
Okay, wonderful. I hope you guys were all able then to finish your kind of last minute conversations. We had a bit of a hiccup with group 1 and 3 on the Miro board. So the way that we'll do it is we'll go ahead and start with group 2, then we'll go to 4, and then we'll come back to 3 and number 1 if you guys have any concluding remarks. I know group 1 was having a bit of difficulty with everyone's previous commitments. They weren't really able to join with the audio to conversate together because of different situations. But anyways, let's go ahead and start with group 2. I'll pass it over to the moderator.
Hello, good. Well, it's morning here where I am, but good day, everyone. I'll be the moderator for group 2. Can one of my group members just share screen, please? Okay. So for the first question, what digital determinants of health have you encountered in your professional training or personal life? So we came up with education and access. So persons being digitally literate, knowing how to use, digital software, different digital technologies, as well as access. So in certain persons from certain socioeconomic backgrounds, they may not have equal access to health technologies, basic things such as Wi-Fi, digital devices. So those are 2 that we discussed, and the most important one, which we nominated for step 2 would have been policies on privacy and data use. So yes, there's a move towards digitalization, but there's a lag in terms of policies governing how the data of a population is protected and used. Regarding question 2, how should medical education and public policies be updated to respond to the digital determinants of health? So we spoke about training on the usage of resources, so incorporating that as part of the medical curriculum. For a lot of us, it's not a part of the medical curriculum, so that would be something that could be incorporated. And governments can, in terms of access, piggybacking on that point, governments can partner with private tech companies to build digital infrastructure in marginalized communities. So for example, having spaces, public open Wi-Fi spaces or computer hubs where persons can access resources for free. We also had another point which was nominated on the side. So youth involvement within the curriculum, so not just tokenism. So a lot of times, well, since youth are particularly impacted by digital health in numerous ways, and where some of will form a significant proportion of users were users of digital health, it'll be important to involve us in the curriculum reform and actually taking our ideas and suggestions seriously. For the last question, how can the future health workforce help to address the digital determinants of health? So within student organizations such as IFMSA, being advocates for some of the issues that we would have highlighted before, and to help to adopt and develop policies on data protection. And those were the main points that our group discussed. Thank you.
Wonderful. If we go ahead to group 4, please.
Yes, so I'm here on behalf of Group 4. So regarding the first question, well, in total, we actually had pretty similar ideas. A lot of the ideas were similar to what Group 2 presented. So starting with question number 1, the digital determinants of health that we've encountered. So the biggest ones that we've nominated were access and literacy, access being either access to internet and fast internet connection, but also access to programs, access to equipment, and access to sites that might be, for example, blocked in some countries, or that might be under a paywall. And then the second one being literacy, which oftentimes is very lacking, as we all know. We've also talked about the hospital information systems and teleconsultations and these related things. Moving on to question number 2. How should medical education public policies be updated? So we started with medical education, and we talked about potential curriculum redesign. As Group 2 mentioned, we think that it's very important for the medical students themselves to participate in the curriculum redesigns, and the redesigns should account for digital health being addressed as well. But moving on to the policies addressing not just the medical education, we think people of all ages in general should be included, or their opinions should be included in the policymaking, and the policies shouldn't be aiming for just that one middle age group general sort of idea. And we also think that it's very important to pick a value-based approach that is oftentimes overlooked in the digital world, as we know. And then moving on to the question number 3. So how can the future health workforce help address these digital determinants? So for one, it's very important to raise awareness of these digital determinants of health. It can be done through various means. One of them is also peer education. This may be able to cross the borders that sometimes like are in between different age groups. So if we take advantage of peer education techniques, it might ease these things. Then also destigmatize the the digital transformation of health. In question number 1, we talked about sort of a social determinant of the digital transformation, or how to call it. It's that we sometimes live in social bubbles that some of them might be, for example, against digital transformation, and these opinions of these of these social bubbles are naturally shaping us. So in order to cross these bubbles, peer education and raising awareness would be very crucial. And also it's important to work on the engagement and as parts of the health workforce to become agents for this transformation. Sorry if I'm taking too long.
No, thank you, Miki. That was really great. And I'm glad that there were some points that were crossover, but I think you really started to get into that power dynamic that Ilona was bringing up in the beginning. So around the curriculum and including the young people who are going to be using that and learning from the curriculum, I think is a really great idea, especially with the third question around the policy making. I won't go more into it, but I think you brought up some really great points. On to group 3.
Yes, I'm gonna present for group 3. Let me just share the screen. All right. So for question 1, we touched a lot of topics during our discussion, which already been said, like digital literacy, but also cost of technology, not only internet, also cost for devices and cost for platforms. Second one, to how should public policies be updated? As discussed earlier, we clearly want to see evidence-based action here. We want to see an update on open access, also for platforms, for educational platforms, but also for research. And for sure, we want to see more inclusion of public, of the medical community, youth and students. And that is directly going into question 3. So for sure, inclusion of youth in the decision-making, but also like the part of educating of patients, like in primary care, can be like directly help us address the digital determinants. Other parts we discussed clear advocacy action and is direct influence through research for digital tools and decision making. Yeah, that's in short is group 3.
Wonderful, thank you, Danielle. Is there anyone from group 1 that is something that's missing that you guys had thought about that you'd like to chime in now? Or is it okay if we go ahead, Dominique?
Okay, hi everyone, good afternoon. Please, can you hear me?
Yeah, perfect.
Okay, this is Dominic. I'm trying to give the summary of what we talked about in group 1. Based on the first question, we talked what digital determinants of health have you encountered in your professional training or personal life? So here we talked about digital literacy, cost of technology, that is both internet and devices, then access to platforms. We talked about free internet. Then on the second question, we discussed how should medical education and public policies be updated to respond to the digital determinants of health. Here, we brought up 3 basic points. The first one was evidence-based actions, then open access to data, then inclusion of public and medical community, youths and students too. Then medical curriculum with awareness in the use of digital tools. Then the final one, we discussed how the future of health workforce can help to address the digital determinants of health. We talked basically, anyway, we didn't have the time to discuss this, but these following points were highlighted. The first was advocacy action. Then the second was involvement of the youths. As our prof said today, that youths have to be at the center of decision making. Then the third one was we have to educate patients, not only educating the patient, but also the health caregivers. Thank you very much.
Wonderful, thank you so much, Dominique. I know that we only have a few minutes left and we've got a couple Slido polls and a summary from Alona. So I'm going to really quickly paste a question in the Slido poll. If you're all able to go there, I can also share my screen. And while we're doing this, Alona, if you want to go ahead and start with some of your closing remarks, and we'll try to get you out of here no later than a couple minutes after, if possible.
Well, thanks very much, Whitney, and thank you to all of you. I think the messages are really coming together and are very clear. There's a whole package around creating awareness, the importance of literacy, new curricula, etc. The second is really that you said you must be agents of transformation. And I think, if anything, that's one of the key messages, to be agents for transformation through co-design, advocacy, and the many issues that you've mentioned. I think you also gave a very strong message on equity and inclusiveness, and all the issues around access, open platforms, cost, etc. But what I particularly like, that as medical professionals, you included patients. I think that's such an important message, that it's not just about us, in quotes, but that the patients, and particularly also the social determinants that we see in relation to many patients, are important. And then around policies, that it's very much about policies that enable, that enfranchise, and that protect. And I think, again, here it's the protection of the individuals, the privacy, etc. But within a healthcare system, it's also the protection of the patients. And of course, on top of all that, because we are health professionals, because many of us are involved in research, the importance of data and everything that's related to open data, data access, etc., which then turns into knowledge and evidence, is absolutely critical. So thank you very much for those messages. And it's been a pleasure to be here. I tried to jump a little bit between the groups. I got a little bit of idea here and there. And I want to thank you for spending part of your Saturday today. Back to you, Whitney.
Thank you so much, Rolona. A big round of applause for everybody, for you to be able to join in the conversations that we've had today and throughout the whole series. Just a few housekeeping notes. Hopefully I've talked with Adam, and that we'll be able to connect with you guys as a cohort in the future for different opportunities and things that come our way. So the one thing is also around the certificates. Hopefully you will receive those within this week around your certificate of attendance for this workshop series. It's something that's a pilot project, and we are really curious to see how you guys have kind of taken it in, what's the good things and the bad things. So we'll be sending out a post-event survey this week as well. And we'd really appreciate if you took about 5 minutes to complete that, so that we can then prepare for the following year and make improvements based on your responses. I think that's all from my side. If you have any follow-up questions, please feel free to email me directly, or Adam as well. We'd be happy to get in touch. And I think that's all from my side. Anything from you, Adam?
Just want to thank everybody for joining us and attending a few sessions. I want to thank Professor Ilona for giving always great notes and great speeches. And thank you, Whitney, for organizing this whole thing. And just a picture. And
Pictures.
I'll let everybody enjoy their afternoon. And just for people, the recording will be uploaded to Moodle, soon, because we're in the transition period of IFMSA. So when uploaded, you will be notified. And for the certificates, I'll try to do it before, like Whitney said, before the end of this month. And now, picture, Whitney, can you you're not sharing, right? Wait. 1 second. Okay, I'll take one picture is enough. So let's say 1, 2. That's it. Thank you, everybody, for being with us, and good afternoon.
Yes, thank you all. Bye-bye.
Bye.